Good morning, everybody. Thank you very much for the lovely welcome, Anna. It's a pleasure to be here and to be part of Glaucoma New Zealand and what Glaucoma New Zealand is doing for us all as New Zealanders. My brief today is to talk about eye drops, and this is actually a really broad topic. I'm going to try to keep it reasonably simple so that it makes it easy for everybody to understand. I'm not going to talk in specific details about certain eye drops, but there will be a time for questions and answers later. We all know that eye drops are usually the initial treatment for trying to lower the pressure. Just to take a step backwards, the only proven treatment that we know for glaucoma to stop the optic nerve damage getting worse is to lower the pressure. And the most common way to lower the pressure in the first instance is to use eye drops. There are quite a few different types of eye drops, as you can see here on the slide, different shapes, bottles. I often will say to my patients, when you come into the clinic and I see you, it's really important that you either know the name of the eye drop or you bring a list of them with you, because patients can easily get confused between eye drops. Is that right? And if your vision isn't that great, sometimes you think that you're putting in one eye drop and you're not, you're actually putting in another. So I say to patients, to avoid the whole Chinese whispers business, please either whenever you come to your appointment, bring your eye drops or know what they're called. And a lot of patients have taken that on board and are really good at doing that. It's not uncommon from time to time that a relative will come with an elderly patient or a caregiver and will find out that I think that the patient's been taking a certain combination of eye drops for years, and I'm just gobsmacked to find that in fact they haven't been, and it's been something completely different. So I think it's really important to understand what the eye drops, the name of them, and to understand what they do. Other colleagues will be speaking about laser treatment and about surgery today, but those are the other two main options for getting the pressure lower. So, glaucoma treatment to lower the pressure has two ways of working. One of the ways is reducing the amount of watery fluid that's produced, and the other main way is to increase the amount of fluid that drains out of the eye. So those are the two mechanisms by which most drops work. As you can see, this is a diagram of the inside of the eye, and it shows where the fluid is produced. It comes around the edge of the lens and into the front chamber and drains out through a structure that we call the drainage angle. There's a bit of a meshwork there which stops big particles getting through, and the watery fluid goes back into the vein, the main vein around the drainage angle, and back into the main circulation. So you don't want big bits of stuff getting into the blood vessels in the body. But you can see that there's quite a large group of medications that work at reducing fluid production, and quite a large group that increase the drainage. And some of them have an effect on both, and that's quite helpful. Often when we're choosing our eye drops for our patients, we'll try to use a combination of these effects of the eye drops to help them to work better together. Well, all medication, no medication's perfect, and all medication has side effects. And we tend to have this idea that eye medications are like this magic bullet, that will take them and we'll be fabulous again and we'll be able to see and it'll be great. But that, sadly, is not reality. As we know, all treatment for glaucoma doesn't make our vision better. It just helps to stop it from getting worse. And all medication has side effects. Whether or not you experience the side effects or not, all medication has the potential to give side effects. Now, I sat there for 2 minutes and wrote this list of side effects, and it's quite extensive, and some of them are very unpleasant. What patients often don't realise is that you're putting in an eye drop, but in actual fact, that drug that you put on your eye can affect your whole body, and you can have side effects that affect your heart, your lungs, and other parts of your anatomy that we won't go into that can have an effect on your quality of life. We all know that patients with glaucoma experience increased anxiety, reduced quality of life, and have a higher rate of depression. And so it's really important to be aware that eye drops can cause side effects. What do you do about it? If you notice that you're starting to get a side effect, it's important that you have a read of the pamphlet, or you can Google it, though Dr. Google isn't always correct. And if you think that you're experiencing a side effect from some of your medications, it's really, really important to tell your eye specialist. If you don't have easy access to your eye specialist, you should tell your GP, and then your GP can tell your eye specialist. If the side effects are really bad, then you should stop the medication. And that can be done in conjunction with either your ophthalmologist or your GP, or just on your own. But if you do stop them on your own because you're having side effects, don't wait until your next appointment to tell your specialist about it. You actually need to tell them straight away if you need to stop the medication. Okay? Often patients will ask about generic medications. Generic medications are favoured by Pharmac. Pharmac is the funding body that contracts to buy the medications on behalf of us all. And they're government subsidised medications. It saves the government an enormous amount of taxpayers' money using generic rather than originator medications. So that's one of the upsides. In terms of are they equivalent, yes, the active ingredient in a generic medication has to be proven to be equivalent to the originator medicine. Otherwise it won't be approved by MedSafe, and then it would not be contracted by Pharmac. What's a bit different though are the other ingredients. And I tell my patients it's a bit like a chocolate cake. We all love chocolate cake, but it's not good to eat too much of it. And every chocolate cake has a slightly different recipe, but it's still chocolate cake, right? And that's because it's all got cocoa in it. So it's a little bit like the brand, the drug latanoprost. You'll all be aware that Pharmac have changed the funding for the high site generic to another generic. So and sometimes patients will come to us and say, I'm having some side effects now, the medication has changed and I have noticed. And that's because the active ingredient is the same and has the same equivalency and has the same effect, but the other things that they put in it to create the drop don't have to be identical. So everyone has their own recipe, a bit like for chocolate cake, and some people notice that. And if that's the case, sometimes we actually need to change the medication for the patient if it's creating problems. Preservative-free eye drops for glaucoma are something that I actually feel really disappointed about in this country because we have very poor access to these. A number of years ago when I was working overseas, there was much better access and we could get practically all the glaucoma eye drops without preservative in them. Preservatives help to stop bacterial growth in the bottles, and they also have a small effect in helping the eye drop to penetrate into the eye better. The main preservative is called benzalkonium chloride, and it's used in general household cleaners and also in pools to help pools stop growing nasty things in them. It's been an historical reason why it's been used as a preservative in eye drops. That dates back to the early days of the FDA and the first eye drops that were produced for glaucoma, but it was basically already proven to be safe enough. And so rather than having to do more studies looking for other preservatives, they just decided to use this one, and it's perpetuated. We know that the preservatives can cause dry eye, irritation, redness, and also some people have a bona fide preservative allergy. Very few of these are available in New Zealand. There's Lumigan Preservative-Free, and there's also Travitan BAK-free, but and Alpha-GAN-P, but those two latter ones have a different preservative which is a bit kinder to the eye. It's called Purite. In the last few years, I've actually written to Pharmac on several occasions regarding a couple of patients of mine who, in particular, really require preservative-free drops and have no other option. And Pharmac has responded that they are unable to fund them. So whilst it has been recommended to Pharmac that we have some available for patients, they decline to fund them. So maybe that, not wanting to give another job to Anna, but it might be something that Glaucoma New Zealand could help to lobby Pharmac for, because I actually think that we could do better on that front. What's on the horizon? A few years ago, an injection into the skin of the eye with a nanoparticle of latanoprost was presented at a World Glaucoma Congress that can last for up to 6 months, sometimes up to 12 months. It sort of slowly releases the latanoprost gradually, and then you just have another repeat injection. That hasn't come to market yet, so I'm not quite sure what's happening. Maybe it hasn't been as effective as what they thought. There is a travoprost delivery device which is in process at the moment. It's being developed by Glaukos, who also have provided us with the eye stent. It has a small amount of travoprost inside, which gradually releases over a period of time without needing to use eye drops, and it's equivalent to timolol being delivered on the surface of the eye. It has fewer side effects when it's delivered inside the eye because it's protected more from all the surface eye tissues and also from the rest of the body because it's just held inside the eyes, inside the eye cavity. So these are very exciting. There's also another similar device which is bimatoprost SR, or slow release. And this is a device which is implanted both the iDose, the previous slide, and this particular product. You need to have an injection inside the front chamber of the eye for it to be implanted, or a small operation for it to be implanted. This particular one slowly resorbs completely. You can see on the slide there that over time you can see that gradually that little white lozenge, or whatever you want to call it, it just gradually reabsorbs. And so, you know, these can actually last for up to a year, maybe longer, and it's quite exciting that there are things on the horizon that are going to make life better for people who have glaucoma in the future. So thank you very much for your attention. I'm sure you'll have questions which we're going to leave until after all of my colleagues have spoken as well. Thank you.